Dr. Carlos Del Rio is the Executive Associate Dean of Emory University Medical Center, a renowned expert on infectious diseases. He's monitoring the outbreak from the ground level in Atlanta. Thank you so much, Doctor, for joining us this evening.
Good to be with you, Sarah.
So what can you tell us about where you stand on Georgia's reopening and whether it's prepared, with more businesses set to open on Monday, including dine-in restaurants?
Well, I would say that this is a bold move by the governor, and I understand why he's doing it. He's doing it because of the economic concerns that he has. I mean, the economy in Georgia has suffered significantly as a result of this epidemic, but I am worried that we have not met the requirements that the White House and others determined that were necessary. We haven't really seen a 14-day decrease in the number of cases. And from where I'm standing in hospitals, we're not seeing a huge increase in patients. We're seeing a flattening of number of patients. We're seeing a slight sort of trickle of patients coming in. But I worry that that may be very different 2 weeks from today. I was very encouraged to hear your previous guests talk about the things they're doing in salons to prevent, the social distancing, the wearing masks, the wearing gloves. And I wish people continue doing that. But I just worry about restaurants and I worry about other places. So I'm nervous. I can't tell you that I'm not, but we'll have to see what it is. But in the meantime, what we really need to work on here in Georgia is scaling up testing. We're very low on testing. We have to do a better job testing a lot more people. And we have to also scale up significantly contact tracing, which we really don't have at this moment.
Now, I was going to ask about those two factors. Where is Georgia in terms of its testing rate relative to the rest of the nation? And are there any contact tracing going on there where people are notified if they've been in contact with someone who's tested positive for the virus?
We are pretty low in testing. We're probably in the lower third of all the states, and the percent of population has been tested. But I can tell you there's some very good ramp up happening, and there's very good public-private academic partnerships. My own university, Emory University, is part of the effort of really scaling up testing, and I think we're going to do a lot of more testing over the ensuing couple days. So I think testing is going to come up in a significant way. We have a ways to go. I'm not going to say that we're not, but I think testing is going to come up. Contact tracing is a different story. We need to hire people. We need to really implement contact tracing. It hasn't been done, but I can tell you that a lot of the partners in industry, a lot of the Fortune 500 companies that are here in Atlanta are more than willing to help. And let's not forget, we have CDC here in Atlanta. This is the hometown for the CDC, and CDC is obviously very interested in making it work. So my hope is that over the next couple of weeks, Georgia will actually have a model of what needs to be done to get out of this crisis.
In the meantime, what are you bracing for in terms of your hospital? And do you feel prepared with the equipment that you need, the ventilators, the masks, the cleaning supplies, and everything else?
I would tell you that at this point in time, the hospitals that I'm in contact with are in both, Grady Hospital and Emory University affiliated hospitals, more than 8 hospitals. We're in good shape. We have capacity, we have ventilators, we have supplies. So if patients continue coming in at the rate they're coming in, we will be fine. If there's a sudden huge spike in cases, we will obviously run into problems. But as long as there's not a sudden huge spike in cases, we will be fine. But of course, we are preparing. We are worried. We are concerned. But at the end of the day, we need to be ready because this decision has been taken by the governor. And our job right now is really to scale up and to be ready and to do the right thing so we can actually be successful. We cannot let ourselves drown. This is a little bit like being in an ocean and the waters got rough. Our job right now is to swim and be sure we stay alive. And more importantly, I want to be sure that we don't have patients die. I really want to decrease mortality of this disease.
Have you been in contact with the governor at all? Is there any communication going on from the medical community with the politicians?
If there has been, I know there has been from the CEOs of the hospitals. I've been in close contact with the director of the Department of Public Health, Dr. Kathleen Toomey. She and I communicate quite a bit. And again, I think that she is doing what needs to be done. And I think she's reaching out to the appropriate people to really implement the programs she has to implement. She has a big task ahead as far as scaling up testing, as far as doing contact tracing. But my way to reach into that decision making is really through Dr. Kathleen Toomey, which I've known for a long time.
We wish you well. Dr. Del Rio, thank you for joining us tonight.
Delighted to be with you.